So to get to that point, a patient's got some risk factors that lead to the heart disease. What are those risk factors?
Well, generally, for younger people, the main risk factor would be a family history of heart disease or smoking. So they're the most sort of striking risk factors when someone comes in to see me. I say, well, we've got a family history, and do you smoke? Because they're the alarm bells for a cardiologist. We also look at things like raised cholesterol, diabetes, being overweight, whether you've got sedentary lifestyle, and high blood pressure. I mean, they're the sort of things that we would look for in the history in terms of cardiac risk factors. So when we assess a new patient, we always ask about risk factors because that gives the cardiologist a feel for what the chances of having heart disease are. So if you've got no risk factors, we are not so suspicious, but if you have a lot of risk factors, we're more suspicious. Having said that, there are some people that come in with no risk factors when they're 40 with a history of chest pain when they go for a walk, and they can still have a blocked artery. So just because you've got no risk factors doesn't mean you're not going to have a heart problem. Unfortunately, a lot of people with no risk factors still get heart disease, but it does give us a clue as to whether you're going to get a heart problem, and perhaps we can address those risk factors more aggressively to try and prevent a heart problem if they are so-called modifiable risk factors like smoking and being overweight, high blood pressure and high cholesterol.